Hi everyone. In this video, we will dive into the common mistakes that cause candidates to fail medical exams, especially the clinical exams such as OSCEs, long cases, vivas, and postgraduate exams like the mrcem and mrcp. Poor exam technique, even when knowledge is good. Not reading the question or station instructions carefully. Answering what they think is being asked rather than what is actually being asked. Ignoring command words such as list, outline, justify, prioritize. Now make note that if you ignore the command words and instead of list you go on to describe or write a great lengthy answer, you're going to run out of time. Running out of time due to poor pacing. Not structuring your answers clearly. Remember that many candidates fail not because of lack of knowledge, but because of exam skill failure. Lack of structure. Examiners mark against checklists and domains. Common problems include rambling answers, jumping between systems, missing systematic approach, for example, the ABCDE in emergencies, and no clear beginning, middle, and end. In clinical exams, remember that structure is equal to marks. Unsafe practice. This is one of the biggest reasons for failing. For example, not washing hands, missing life threatening diagnosis, failing to escalate appropriately, prescribing unsafe doses, ignoring abnormal vital signs. Examiners will often fail candidates for safety concerns even if the rest is acceptable. Poor communication skills, especially critical in OSCEs and PACER style exams. Mistakes include not introducing themselves, not confirming patient identity, using excessive jargon, interrupting patients, not showing empathy, failing to summarize or safety net. Communication failures can outweigh strong clinical knowledge. Incomplete data gathering. Missing key red flags. Not asking ICE, ideas, concerns, expectations. Not clarifying drug history or allergies. Forgetting relevant risk factors. Exams test focused history taking, not random questioning. Weak clinical reasoning. Listing long differentials without prioritizing. Failing to justify answers. Not linking symptoms to diagnosis. Giving investigations without rationale. Suggesting inappropriate management plans. Examiners look for logical thinking, not memorized lists. Poor time management. Spending too long on history, which will lead to rushing during the examination. Not leaving enough time for explanation, and not finishing the management plan. Many candidates fail simply because they never reach the critical marking domains. Lack of professionalism. Candidates sometimes may be arrogant or defensive. They may argue with the examiner, or blame patients, or breach confidentiality. And some may even have inappropriate humor. Professional behavior is always assessed, explicitly or implicitly. Overconfidence or lack of confidence. Overconfidence would lead to careless errors, and lack of confidence would result in hesitant or vague answers. And changing correct answers due to panic is another mistake candidates sometimes tend to do. Examiners reward calm, safe, structured responses. Poor preparation strategy. Some candidates involve themselves in a lot of reading, but this reading is passive instead of being active practice. They don't engage in timed practice, no mock exams, or they study alone without feedback. So I would advise you to get together with a small group of colleagues and study as a group. The next common mistake is ignoring the exam format. Exams are performance events, not knowledge tests alone. So, what are the big three reasons for candidate failures? Across most postgraduate medical exams, unsafe decisions, poor structure, and weak communication are the big three reasons for candidate failures. And with that, we wrap up the 10 main reasons for candidates to fail medical exams. Don't forget to drop in a like, share, and subscribe to our channel. Let us know your thoughts in the comment section and also what you would like to learn about next. See you soon.